Hello friends, welcome to the healthcare today. Today we are going to speak about inhalers. So there is a common myth in the society that inhalers are required every time, or there is dependence about inhalers, or once you start patient on inhalers, patient will be never withdrawn from the inhaler therapy. This is not the case. So when we speak about lung diseases or respiratory diseases, we categorize it into three diseases, three subcategories. One is the pleural diseases, which is like a thin cover over the lung. We can see water accumulating in the pleura, which is called pleural effusion. One is inside the lung, which is called parenchymal disease. And the third disease is airway diseases, where the airways are affected. So when we speak about airway diseases, these are the diseases where inhalers are required. So there are four broad categories in airway diseases. One is asthma, which we all know. One is COPD, which is due to smoking and air pollution. The third one is bronchiectasis, which is usually abnormal dilation of larger airways due to previous infections. And fourth is bronchiolitis, which is usually seen in children, where there is small airway abnormalities which we see. In all these four cases, sometimes we prescribe inhalers. Usually inhalers are required for longer duration or till lifetime in cases of COPD, where there is irreversible damage of airways due to smoking, air pollution and other factors. In case of asthma, around 90% of patients are mild asthmatics, where they require inhaler for few weeks. Around 7% of patients are moderate asthmatics, where they require inhalers for few months. And only 3% of total asthmatics, which are called as severe asthmatics, they require inhaler round the clock. Now coming to bronchiectasis and bronchiolitis, we do your pulmonary function test. According to your age, weight and sex, we determine your lung function, and we see your lung function is appropriate to that age group or not. If there is some deficiency, then only we prescribe you inhalers. Otherwise, in these diseases, we don't normally prescribe inhalers. Now, the other important thing is about the dose. So, when we talk about inhalers, you can see the dose in the inhalers is very clearly written that it is in micrograms. When we compare with a tablet, now tablet is indirect mode of action. The tablet, once you take, it goes into the stomach. From there it goes into the intestine, it gets absorbed into the liver. From the liver it returns to the heart. From the heart it comes to the lung. From the lung it reaches the airway. So the route of transmission is large. Whereas inhalers, it is a direct mode of action. Just like in case of a skin disease, you apply an ointment or a lotion to have a direct impact. In case of eye diseases, you use eye drops. So similarly, in case of airway diseases, inhaler is the best way to directly make the drugs available to the damaged area. Now, inhalers are least effective when they are prescribed unnecessarily. But if there is a definite indication, inhaler once being offered, it is direct mode of action, it is lowest dose possible, and it is very safe. So inhalers are safe to use. There is no dependence on inhalers. And we also, before prescribing inhalers, you need to understand how the patient is taking the inhaler. You need to always check whether the inhaler technique is right or not. We care about you.